So Gail, let's start with you. What are some common benefits and treatment programs bringing billing in-house?
I believe that it's a quicker turnaround. We found that we sometimes receive our money within a week or 2 weeks. You have more control over what's going on when it comes to diagnoses. It's easier to be the link between the providers and the billing. So we just find that it's much easier and faster to receive our payments.
Excellent. What are some of the challenges that you have, Gail?
I think that mainly it's the insurance companies. I feel that their rules and making sure you know all of the coding that needs to be done and follow up. You'll need to check to make sure you're getting the right amount of money by your codes, and just follow up with the insurance companies. I really think is the hardest. Other than that, we found it very simple to use the software to train new people, people that have never done billing or been on a computer before have been able to do it using AZZLY.
Great, thank you. Angela, when treatment organizations come to you because they don't have the experienced billing staff, does it help if you can bill through the same system that manages their clinical and their patient and practice management?
Absolutely. At MedPro, we strive to be as transparent as possible with our clients and really to customize our billing services. We really want it to be a seamless transition from office to our billing services. We have found that it allows for, by using the client software, it allows for efficient communication, mutual accountability in developing processes, and ultimately a better experience for the patient, which is what we're all striving for.
Excellent. Is it unique billing in mental health or substance use disorder compared to like internal med or any of those other or specialists?
Yeah, we have in the 12 years that I have had MedPro, we have worked with a lot of different specialties, and we see that especially in behavioral health, which has kind of become a niche for us because that is where about 90% of our client base is from, is the behavioral health. So we have kind of, like I said, become a niche in that area. But it is unique in that when you look at the medical industries, medical specialties, that they are more nationally regulated, where behavioral health, while the pandemic did kind of bring behavioral health more to the forefront because patients needed the services, it is still very much state regulated. So that meaning CPT codes, what you bill, the services that you are billing for, those are nationally recognized codes across all the states. Where, example, peer support. Peer support is still very much state regulated. We are here in Indiana. Peer support is a billable service and reimbursable service, whereas in other states, we have clients across the country that see challenges with billing for peer support, whether that be that they have to have a certain certification or it's not billable at all. So yes, it is important whether you have in-house billing or you use a company like mine to handle your billing, that they have the knowledge and the resources available to have the specific mental health billing capabilities.
Excellent. We did a credentialing webinar a bit ago, and we were talking about the accreditation process as it applies to peer support now, and even case management. Both of those are very much needed, very much supported in behavioral health and mental health. And most providers see great value on them. It will be encouraging if in time they do get properly coded so that services can be reimbursable, and
Right.
the licensing that goes with it, right? You have to have the licensing
Yes.
that goes with it in order to bill.
Yeah.
So it all makes sense. Thanks for sharing that.
Yeah.
Are there any common reasons that you see why behavioral health entities, facilities have claims denied? Is it unique to them?
I don't know if it's necessarily unique to them. I think it's just with time, again, medical, offices are used to seeing and asking for certain information. The main two denial reasons that we see here with our clients is really kind of the front line, that we're not getting whether that be the office, the provider is not getting the correct patient demographics, or the correct insurance isn't being entered. And that's really where your billing process starts, is getting that information. That is your foundation for billing, is that front office worker, front desk, being able to empathize with patients when they're coming in, but also making sure that they are entering the information correctly, that they're checking eligibility. And then we look at prior authorizations, which we're going to talk about here shortly, a little bit more in depth. But, I can't stress enough how important it is to make sure your front desk or you as the provider know how important it is and how essential it is to get that information up front. Because, we do want to treat, we are focused on the patients, but we don't want to cause them any undue stress in the end, whenever we didn't have their correct date of birth or we didn't have the proper authorization. So they're now receiving a very large bill, which could cause additional stress for them.
Excellent. Great feedback. Gail, I'm going to ask you the same question, because as office manager, you or your staff are that front desk, right, Gail?
Exactly. And I agree. Those are some of the main items, which is why I like to do in-house billing. So it leads back to that. We have the personal touch. They come into the office. They know who we are. We can ask them all those questions and gather that information. I don't say so much denied claims, because we say rejected claims, because that scrub at the beginning of AZZLY, once you send that in there, that's the scrub that tells you. It can tell you right up front what information is incorrect, correct it, then send it to the insurance company. And that can be scrubbed within a day, and you get that answer. You send it to the insurance company and it's already clean. And the insurance doesn't have to deny it, because once an insurance denies it, it can take longer for them to correct and reprocess it. So we want that clean scrub right from the beginning, so that we don't get the denials from the insurance.
Yeah, working with Heather and Joyce and the team there on the setting up the business rules to know how to scrub cleanly and what potentially could be denied, getting that business rule set up in the front end to scrub within AZZLY. And then when the claims do go to Evality, that's a second scrub that goes on before it even gets to the payer. So you're absolutely right, Angela and Gail, that the front desk work, we always say in AZZLY, garbage in, garbage out.
Exactly.
And so if you enter it correctly the first time, it processes all the way through to the claim. So having that person within the facility who's doing those prior auths, who's doing the eligibility, who's verifying the insurance, I think is extraordinarily helpful in making sure that a claim goes in clear and clean. Alexis, let's bring you up. Let's talk about collecting payments. Can you share with us what it means to partner with GPI for merchant services, especially in healthcare?
Yeah, hi. Yeah, happy to. So with Global Payments, a large company, we have 4.6 million merchants. We're processing around 50 billion annually in transactions, and partner with companies such as Starbucks, Volkswagen, JP Morgan. But partnering with Global Payments, we have this global backing, but we're an agile part of the Global Payments family, and we're built to support our ISV partners like AZZLY and your users. So our primary focus is the integrated advantage. So what does that mean? That means that we're seamless. We're a seamless functionality within AZZLY, so that you have more payment collection options. So less time spent reconciling at the end of the day, which saves you time, saves you money, and eliminates that manual process.
Yeah, we worked very closely with your team in order to add additional features and functions so that we get accurate information shared between the two, so that when it comes to the auto posting, when it comes to reports that can be generated in AZZLY through the GPI interface, it's worked very well. We're excited because we're also going to be introducing it in our patient engagement tool and allowing for the ability for individuals to pay through that patient portal. So we're very excited with our relationship with GPI and a lot of the new features and functions that you've introduced. Can you talk about healthcare and your presence in healthcare? Because if I recall correctly, you're pretty deep in the healthcare. You mentioned some Starbucks and huge names out there, but you have a very strong presence in healthcare, don't you?
Yeah, yes, that's correct. Especially with the integrated company. We do a lot in this vertical because we understand the payment functionality needed to be successful in this industry. And we understand that patient responsibility is increasing because insurances are becoming more strict with what they cover. And because of this, patient payment automation is a must. It's more important than ever. In fact, we've done analysis with one of the biggest RCM companies in the nation, and they found that through healthcare facilities throughout the US, they're holding over $2 billion in patient debt. So we want to help facilities enable multiple patient payment workflows, just knowing that the more ways you have available to pay, the more likely patients will be settling their payments.
Yeah, no, it's a great point. That's a lot of debt for healthcare. Frightening. Alexis, recently we've been asked by numerous clients to pass through a standard service fee charge on credit cards, you know, depending on the state, depending on the credit card company that they receive on patient payments. Y'all helped us achieve that. It was really important because 3% is 3%. And as you said, as more patients have responsibility to pay and as more telehealth and more services are provided, that there is a copay or a payment, that 3% adds up. So, you know, I wanted to thank you. It was a big ask from a large group of our client base, and you came through. You came through, and you came through timely. And you know, if you had mentioned a little bit about your competitive pricing, because it's a pretty simple process when we refer you a client that may have interest. Can you touch upon that a bit?
Yeah, of course. Yeah. First off, yeah, you're exactly correct on the service charge. You know, that's becoming more and more common. People are wanting to pass on that fee. So we are excited to roll this out to any clients who want to pass on that expense to their patients. And then as far as savings, you know, since we are a single source payments company, we don't have those third-party costs that other competitors are charging. So we're happy to always provide a free side-by-side analysis so you can see the savings that we can offer while having an integrated system in your office.
Yeah, thank you. It's very efficient. And I will share from our implementation team that they're extraordinarily impressed with your setup and implementation. I mean, we bring you together with the client, we step back, you work your magic, you impress them with what you can do and the fees, charges, and the reasonable cost of it. But then you have a really strong implementation team that steps in and just boom, bang, you know, sets it all up, gets the user very comfortable with it, cites your portal where they can see additional information if they need to. Very, very impressed. I'm very impressed with the quality of service that your team, you make it easy. We try to make it easy on our end, and we thank you as a partner to make it easy on your end as well.
Appreciate that.
Okay, so, you know, having that merchant service embedded in the managed payments, it really does allow for that tight integration, and being able to post payments automatically, not have to have that human intervention. If you're taking a credit card or using a service out, to be able to have to manually post it, you can do it, but there's just so much room for error. Another feature that we like is the ability to set up recurring payments. Our users like is that recurring payment feature. You know, you're PCI compliant. We don't have to hold a credit card. Our facilities don't have to hold a credit card, any of our client base. And that safekeeping through GPI is a comfort zone. And you know, just it works very well, the recurring payment feature. I wanted to share that with you. Okay, so Gail, let's go back to you. What are some features, looking at a billing platform, and you've been on AZZLY for quite some time now, that you find most beneficial? I know you've tuned it to work for you, but are there some features that you would recommend to our audience that they should really focus on?
Well, I like the fact that you can set up rules before billing. So we make our providers finish a DAP note before we bill. That's good for the insurance company. If they want to see the paperwork, we know that it's already done. And it's also an incentive to the providers to be able to get paid. It has a lot of filters that you can use. It has color coding, which makes it easy when you go in and look to see what's ready for billing, who's finished their paperwork. I like the fact that it brings the ERAs directly in. We can now post the ERAs directly through the software. We can look to see if the patient's paid correctly, which is a new feature that I love. Thank you for doing that. So you can look at all this stuff all in one section. The biller can see everything that needs to be done right in the billing section.
Yeah, it just keeps you in your own world, right, Gail?
Yes.
I like that. Yes, one of the billing rules, and many had asked for, is really having a requirement that a document is finalized and signed before the biller takes it and that claim is filed. In the past, it was a lot more legwork for a biller to try to verify, is the documentation done? Having that automated certainly drives some efficiency on your end, right?
Yes, definitely.
Great. Angela, you, as far as a billing company, when you look for billing platforms, and you know, you've been a wonderful giving us great feedback, Angela, what do you look for in a billing platform? What's most beneficial for you?
For us, we here work in probably about 8, 9 different systems every single day. I can say AZZLY has gone above and beyond in the years I've been working with you all. The software is that it is all there. It is all in one place. It's easy to read. Claim submissions, you know, we were talking about the scrubs. We have a part of our policy is when we go to the auto-generate claims in AZZLY, we also do a manual scrub. So we take the extra steps to check each authorization and make sure that it is covering those dates of service, that it is the correct authorization for services rendered, and then that it's got the correct modifiers. While we already have that set up in the charge master in some cases, you know, we do just take that extra step to say, hey, yep, it's there. We looked, and just to ensure that that scrub is going through. And then you, AZZLY and Availity, are also doing that additional scrub. So the ease, the time, you know, it's a fraction of the time compared to some of the other systems. AZZLY also allows me to communicate and my staff to communicate with our clients very easily. You know, we can get answers, you know, even though we are out of the office from our clients, we can communicate with them pretty quickly and get answers and not delay those payments from the insurance and getting claims out as quickly as they're being locked.
Yeah. You know, Angela, you brought up a good point. You know, everyone who bills and has been billing for years has their own process, has their own way of doing things. What we strive to do is automate as much as possible and allow for a biller to be a reviewer, not a doer. Correct. And I like what you just said. It doesn't take away that second set of eyes to review something to see, is it done properly? has a modifier been changed? Did a payer change something? Has a code changed? It gives you the opportunity to really be on top of it for your client base. So we don't like to move the cheese of billers. We just like to make it, deliver it up so that they can go through their process more efficiently at a faster speed. So thank you for that feedback and appreciate that comparison out there. Let's talk about a favorite subject that we did that webinar on is prior authorizations. Angela, I have to laugh because I did ask you about this, I think last week.
Yes.
What do you do about prior authorizations and what recommendation can you give to those that are attending today?
So in speaking for me, looking at my staff, when it comes to the billing aspect of prior authorizations, AZZLY does a great job in making sure that everything is right there. Like I just touched on, that we can see that in the auto-generate claims to making sure that those authorizations are on there. But really it starts again at the front line. You know, when you get that authorization at the office and you've got all the information, you can go into the patient's insurance tab, add that authorization, add the days or the units that are authorized, add the date span. It's all right there in one section. And then we also like to take it a step further and ask that our clients put that information, the actual physical copy of the authorization, into the patient document section, for the main reason, in case we see denials from insurance all the time, that the prior auth is not on the master file when we are sitting here looking at the document in hand or on our screen. But that aids as an attachment if an appeal is needed in that case. But then, you know, then going into the auto-generate, that authorization will pop up for the billing section. It'll attach to the claims. It's always on there. If the authorization is listed and the appropriate amount of days or units are still available. Then there's also in the reporting section for the office, for our staff here, that you can run the authorization alert report that you can quickly scan, see who needs additional services authorized, or maybe they're going from inpatient to partial hospitalization and you need to know when the last one ended so that you can transition them to the next level of care. Again, everything is right there within the system. It makes it really nice that you're not having to go out to different portals, to the insurance portals, to look for those authorizations.
Yeah, Angela, thank you so much on that. And, you know, we talked about prior authorizations and the importance of, if possible, if you have the staff, the importance of getting that prior authorization at the facility level versus having a billing company do that. Is that your feeling?
Yeah, we have, again, over my 12 years, we've done it a lot of different ways, and we have really found it to be efficient for those to be done at the office level. One, the clinical information is right there. In some cases, it requires in-depth provider information. The provider actually needs to fill out a form, and it can't even be done by like office staff. But, you know, what we do help here is we help aid our clients in coming up with those policies, letting them know what exactly needs to be submitted so that they can get those authorizations in timely, so that they're not rendering services without an authorization and losing revenue. So we help them in that way maximize their revenue by coming up with those policies.
Excellent, excellent. No, wonderful feedback. And I hope everybody is taking notes on that one. We do have a recording that we will share at the end. Alexis, I think you have your hand up. So you're hogging the screen there with your video. That might be causing it. There you go. I'm not sure. Gail, do you want to make any comments on prior authorization?
Nope, I have to say I agree with all of that. And I have found that less insurance companies are requiring authorization for mental health as it has become up in the forefront. So mainly it's EAPs, but we do the exact same thing. We want a paper copy, we upload it into patient docs. And yes, when you go to bill, you can see it right there in the billing. It pops right in there, and you can make sure you have enough visits left on that auth. So I agree. Everything that she said is what we do in our practice also.
Excellent.
Very easy in AZZLY because it's right there.
Yeah, it's a feature that, you know, I know the team really worked on because we didn't see it and we didn't hear about it in anyone else's system. The ability to put in a 10, and every time you have a session with the individual, it counts down. I mean, again, it's using technology as it should be, you know, so that you can become a reviewer, not a doer, and get rid of those sticky notes for sure. So we all know it's time consuming. I do know from our team that whenever they've been asked to do prior authorization for a facility that might just be starting out, they say, oh my goodness, it's you know, the payers don't make it easy. So Gail, that is good news. And you're right, they've been talking about it for a long time to eliminate prior authorizations.
Right.
But in the meantime, it's you know, we added another feature whereby you can select certain records out of a client's chart, the patient's chart, to send electronically by e-fax, because the payers still use fax, right?
Correct.
Can send records with a cover sheet and for that prior authorization, so that you can have the documentation and it stores right in patient documents area. So we're trying to, you know, again, we're just trying to assist on the billing side as much as we can. The fact that we've got the clinical documentation there, why not get it to the payers? If they're asking for it, let's have an easy way to deliver it to them. So thanks for your input on that one. Alexis, do you want to talk about the first step with getting a quote from Global Payments from AZZLY, or like any EHR? I'm sure it's your process is the same, but you've really made it easy for us in order to refer someone who just joins us or somebody who's with us and said, you know what, I'm going to take a look at GPI. I'm going to compare it to my bank. I'm going to compare it to Stripe. I'm going to compare it to any of the services out there. Alexis, you want to make a comment in regard to that?
Yeah, hi, happy to. Yes, so it is a very easy process. We have a link that after the webinar that you guys will be sent to one of our landing pages, and there you can just input your name, contact information, and then one of our integrated consultants will be reaching out. They'll look for a recent merchant statement within the last 90 days, just so we can put you on the best plan for the kinds of transactions you're taking, the best rate plan for your business, and offer a free rate analysis. So it's a very easy step. They can walk you through that and answer any questions, because we know that there's so many other options, there's so many rates, but they have a great handle on all of this. So happy to work with anyone.
Great. Alexis, thanks. And thanks for creating that for us. Angela, any final takeaways for organization looking to level up their revenue cycle management?
Yeah, I think, you know, it starts, especially if you're starting a new practice, credentialing, going back to that credentialing webinar that we did last year, making sure that you are participating, that you are contracted with all of the payers that for the patients that you are treating, maximizing your revenue, seeing what your allowed amounts are with those contracts that you have, and that you are billing above that allowable. Don't leave any money on the table, because the insurance is only going to pay up to what you are billing out. Make sure your front office knows policies, procedures, and how important they are to the front end billing process. And then making sure you're locking your notes, getting those done timely, which allows for clean claims to go through, timely billing. Insurance companies are tightening their timelines for timely filing. You know, we're getting into the 90-day range. So if it doesn't go out clean the first time, makes it harder and harder to get that out and get reimbursed timely if it's not right the first time.
Yeah, Angela, and I think that's why we're seeing an increasing amount of, and why we really created AZZLY as an all-in-one comprehensive solution, is because it didn't make sense to separate the clinical from the business side, from the billing side. And it's a big database in order to be able to provide that, but it works. It absolutely works. And we hear when individuals come to us is that, you know, they're still using Excel spreadsheets, they're still faxing, they're still scanning, you know, with their third-party billers in order to get work done, get their claims done. It's human error. There's too much room for error when you're still using a scanning process to get your claims submitted. So, I mean, we're real proud with what we've done, and we really encourage, you know, there's a lot of choices out there, and we really encourage those that are looking and might be looking for the same time is really embrace technology. It works for billing. And I don't know how you could successfully run a treatment center without it because of the demands that the behavioral health payers put in this sector of healthcare.
Yeah.
Gail, how about you? Any final tips?
All of that is, I agree with. You have to have a good procedure in place. And with a good procedure, you can teach anybody to do billing, to follow up on the billing. You want to make sure that every day you're billing your claims, you're collecting money from patients, and that you're following up that at your make sure your claims are paid. Look at the aging reports. And I think that it was the best thing that they've ever done at our company to bring it in-house. I came here, they had a billing service. We brought in-house billing, and it has just boomed. And I taught people that never billed before how to do it. So I think that bringing it in, just have a good process, and it's very simple to do.
Excellent. Yeah, we've really developed our e-learning platform to be based on workflow, and we have a whole section on revenue cycle management so that it really isn't tough if you have a process. And Gail, I salute you, and Angela as well on you really have a solid process that works. And if you're diligent and your attention to details there, you know, you get paid. You will get paid, right? You will get paid. So if any attendees want to learn more about AZZLY and our revenue cycle management platform and the EHR side, Andrew's sharing a link. It might be up there already, is hello@azzly.com. And Rebecca, you might have put that up, hello@azzly.com. And again, just request. We've got some really super demos out there that you can get a real good sense and compare it to what you're doing now and see if it makes sense for you to make a move. So I'm going to hit on a couple questions. We got a lot in. We got about 20 in, so we don't have time. We only have about 9 minutes left. Does AZZLY cover all health plans billing? Yes, we do. Do we cover prior auth as well? Yes, the team answered this, Angela and Gail. We do it very well. Do you offer pricing options for small business? Yes, we have. Andrew, if you would post our Easy Start Plan. We've got a link right on our website, Easy Start Plan. You know, price is very important. If you want to put, you know, your information up, you can get a real no obligation of price back from AZZLY. But yes, we really want to help entrepreneurs that are starting out, that have had some experience in this sector and really are ready to be an entrepreneur and open up their own mental health clinic or treatment clinic. We're here to support you. And so we will work with you on a small business. How to use AZZLY reports to track claim status. You know, I'm gonna tell you, request an RCM demo. See it to believe it. And that's my best recommendation for you. Is it difficult in moving from one EHR to AZZLY? Not anymore. You know, importing patient demographics, setting up the system. We've really flipped the pancake on setup, training, and implementation. I send you a welcome when you sign an agreement, send you a welcome. You get a welcome from our project manager. She asks you to schedule a kickoff call. The kickoff call is 30 to 45 minutes. We introduce you to a smart sheet we use for management of the project, of getting you live. From that kickoff call, in 48 hours, you have access to your system. You can get your hands dirty. You can get in there, from managing staff, managing location, creating your managing payers, charge master, fee schedule, appointment types. We've really made it so that you're going to really use the technology and understand it. So as you add staff, add billers, as Gail had mentioned, add a third-party biller to bill through AZZLY. You've got all the tools in the toolbox with our technology platform to be successful. And, you know, I welcome you to info@azzly.com. Take a look for yourself. We'd love to be able to serve you, and we'd appreciate the business. Here's a question for you, Gail and Angela. How to simplify the billing process. You've touched on a lot. Gail, in a nutshell.
A written process.
Yeah,
It's very simple to
simplifying it.
learn. Joyce, my internet connection is unstable, but I'll try.
Okay.
Writing a process. So writing a process is the simplest thing to do. Again, it's so easy. AZZLY is so easy. It's all set up. It's all in one place, and you can train anybody to do it. And then the follow-up. You just follow the procedures. Every day you have what you're going to be doing that day, and you just follow up on it. It's very simple.
Write a good process. I
Yep,
love it. Angela, how
exactly.
about you?
I'm going to echo Gail. Yeah, process. Take the time to set up AZZLY right the first time. You know, it can seem overwhelming. It can seem like, hey, I've got 10 other things on my to-do list. But if you take the time to do it, I promise it will pay off sooner than later, because it is an all-in-one. They have thought of everything at this point. AZZLY's constantly making improvements. So if you take the time, you have your process, everything's going to pay off a lot quicker.
Sage advice, Angela. Okay, here's another one. How do you suggest we plan for inevitable turnover with admin staff? An external billing consultant seems to offer more stability and less liability. Angela, how about you take this one?
You know, I am, of course, the proponent for outsourcing your billing, because that's how my business is derived. But I can see both sides. You as the provider, as the decision maker for your business, really have to decide what's best for you, because there are benefits to both sides. With outsourcing and coming to someone like me in my business, you have to make sure that the company has the knowledge. You know, going back to nationally versus state regulations, do they know how to properly bill for peer support, how to bill for inpatient services according to the state and to that payer, because behavioral health is so unique still to this day. But also, you know, maybe in-house billing is the right move, because you do want to have that control. But for someone like me, MedPro, we do work and try to make that as seamless as possible and customize that billing package to meet our clients' needs, to communicate with them, to make sure that we all have the same goal and making sure that the patient is taken care of.
Excellent. Thank you. Gail, you want to make a 1-minute comment on this?
Yep, mine, I believe that the process, if you have it written down, the process is very simple. Someone new, you know, people turn over. It's very simple to teach them how to do it. And everything else I believe is the same. Just know what you're doing, have a process in place. And I like the in-house billing because you have more control over it.
Okay. So we're going to skip because we only have 2 minutes left, and I'm going to go to a last question. What are your best practices? And I think both of you pretty much touched on it. And in summation, Gail?
Know what you're doing, have a nice written process down, and that's the whole thing, I think. You have a software that does half of the work for you, but you still have to know how to bill to look to make sure that the billing is getting done right, which is very simple through AZZLY.
Okay. Angela?
Yep, same thing. You know, she's right. AZZLY does a great job at doing part of the work, following up when you receive the denials or rejections. You know, working everything as quickly and timely as possible, closing those notes, getting them so you can get the claim out the door.
Excellent, excellent. You know, we've gotten some wonderful questions in, and we haven't had a chance to answer them all. We will be answering these questions through Gail, through Angela, get their feedback on these questions. We got an interesting question in Q&A, and I think I'm going to let the team dive into that, and we'll respond as well. So Andrew, make sure you grab that Q&A, and because we're running out of time, we only have a minute left, and I think it's worthy of a deeper answer. And ask you all to continue to follow us on Eventbrite. We're going to take a hiatus for June and July. It's summer. And so we won't have a webinar scheduled. Our next one will be in August. We're going to talk about DAX Copilot and AI in clinical documentation. So that will be our next webinar in August. So please follow us. Again, if you would like to see any of our demos, hello@azzly.com. We have business consultants, and they're real easygoing. They'll spend time with you. We want to make sure that AZZLY is the right fit. We don't fit everybody. But we want to make sure that the time is right, the price is right, and we fit where you are right now in your growth. So thank you for the opportunity, Gail. Thank you, Angela, Alexis. Really appreciate your being on board, and have a wonderful, all the attendees, have a wonderful rest of your week. Thank you.
Thank you.